Welcome to the Migraine Miracle Moment. I'm your host, Dr. Josh Turknett. I'm a neurologist, migraine specialist, migraine sufferer, and author of the book, The Migraine Miracle. In this podcast, you'll learn all about how to find your path to migraine freedom without pills. Let's get started. Howdy, Beast Slayers. Welcome again to the Migraine Miracle Moment. In today's episode, I will be answering a question from a recent Clinic Chat live discussion. This one is about whether there are any supplements that can be taken to relieve a migraine attack. Again, this question is an excerpt from a recent Clinic Chat live session with our Migraine-relieving members that we do over Zoom. And if you're interested in taking part in these, as well as being able to submit questions for them, you can learn more about becoming a member at mymigrainemiracle.com. Along with being able to attend all of the Clinic Chat live sessions, there's a whole host of resources there for helping you to put the Migraine Miracle program into action to slay the beast once and for all. One of the things that we talk about quite a bit with our members are all of the strategies that we have amassed over the years for both preventing and ending an attack that doesn't involve a prescription medication, since our members are all interested in ways of taking fewer and fewer of those and no longer relying on them. And we even have a section entitled Ninja Tricks for breaking rebound headache inside of our Beast Slayer Training Academy. Also, we run periodic promotions for Migraine-relieving membership for our podcast listeners. So if you want to see what the latest promotion is for you right now, you can head to mymigrainemiracle.com/moment. And speaking of relying less and less on prescription medications, I want to share a recent success quote that came from Lisa inside of our Migraine Everland member Facebook group. Lisa says, "Morning, I just wanted to share something incredible that happened to me. Yesterday was the first time in at least 6 years, I've been struggling with migraines for 30 years, when I didn't have to take a triptan as I didn't get a migraine. I didn't wake with one, and I didn't go to bed with one. I usually need to take 40 to 80 milligrams plus at least 8 Panadol and ibuprofen daily just to function, and even then it still lingers. It's been a tough couple of weeks learning and implementing lifestyle change, but I know I can do this. Yesterday was just so incredible for me. I'm extremely grateful for finding this new way of life and looking forward to the continued journey, so thank you." All right, so thanks again, Lisa, for sharing your wonderful success. I know there are many people out there who can relate to your story, and I know that there are better and better days ahead for you. All right, and now, without further delay, here is the excerpt from our recent Clinic Chat. Carol asks, are there any supplements you would recommend as an abortive? I know you have the 11 drug-free ways document, which is great, and the 2-part supplement episodes, but I don't see anything on abortive supplements. For example, would white willow, feverfew, CBD work as an abortive or others? Thanks to you. I'm doing great with my migraines, but they still sometimes happen. All right. So pretty much everything that I would consider to be helpful in accelerating the demise of a existing migraine attack is included in the guide outside of pharmaceuticals. The trouble here would be that most anything that worked in the form of a supplement that worked as an abortive would probably carry the same potential risk of rebound, since it's kind of the same thing where anytime we kind of outsource pain relief, the body ends up downregulating its own mechanisms for doing so. Now, the other question would be is in terms of, is there a true role for a supplement in its actual kind of intended use, meaning supplementing, helping the body do something it's already trying to do rather than, trying to use it more as a medicinal effect. In that regard, there's some evidence for using magnesium in that particular way. That came from the recognition that in some cases of migraines, you see a drop in magnesium levels, especially in the spinal fluid, and that led to the whole kind of idea of using magnesium for migraines. And there are some studies where it's used as an abortive, typically intravenously or by injection, and some of those are positive and promising. Clinically, I haven't found it to be as successful, but it'd be something that could be reasonable to try. It's conceivable if you are one of those folks where levels drop, that taking a supplement to help with that could be beneficial. So that would be the only other thing sort of in the realm of supplements to consider trying, at least at this point in time, to my knowledge. And one other question here from Julia. I have just started the program and I'm doing well with the diet part. Let's see, I read Keto for Migraines. I'm now in my 4th week. I'm struggling when I do have the occasional migraine with kicking the triptans. I have school-aged kids and find that without abortive meds, I cannot function due to pain, nausea, vomiting, and so forth. I have tried the salted water and keeping my head of bed up at night. Also the starve and sink, but eventually end up taking an abortive med due to the amount of time I am non-functional due to migraine pain. How do those of you get through this if your pain and nausea basically makes you non-functional for a whole day or multiple days? I'm very motivated to kick these triptans to the curb, but to be honest, the thought of how long the pain and nausea vomit might last scares me. I am taking the magnesium and B2 and walking every day, making sure to get 8 hours of sleep. I do take 3 milligrams of melatonin at bedtime because I read a study that touted its benefits for migraine prevention. And all right, I would just love to know how people get through this stage to the other side. All right, first of all, we totally get it. Many of us, probably most of us, have been there in this exact situation, and certainly can sympathize a lot with this particular predicament. All that we can do is try to make the best decision we can make at any point. And again, I've said this before, but that's my main reason for sort of talking about the downsides of the abortive medications. A few things that come to mind here. First, again, the most important thing is that you're able to make an informed decision. That includes, the fact that the abortives help in the short term, but make us more vulnerable over the long term. And that's not saying, that doesn't mean never take them. Just means that's a factor in when you're weighing the decision, an important factor to consider when you're weighing a decision of whether to take one or not, and which one to take. So, I saw so many people over the years who, took them not really with any awareness that there could be any downsides. And so we're, taking them always at the first sign because that's what they were told to do. And of course, that led to years of chronic migraines and this getting stuck in the cycle that we don't want people to get stuck into. So, simply by having that awareness, I think that situation is going to be prevented. Just kind of like priority one. Second, and I think that Jenny may have put a link to some other podcast episodes where I talked to some interviews with other folks who had very similar experiences and kind of how they got through it, which is really probably the best thing, honestly, to do is to listen to those. But as you've probably heard, if you listen to those, you've heard multiple people say that getting through that first one without a medication was a huge turning point. There seems to be a switch that kind of flips in people's minds once that happens, or many people. It's easy to think that it's just not possible, and I know many of us kind of have been trained to think that the only way to end it, is by taking something, and then if you've done that, if you've gotten through one, once without taking something, then kind of the whole world shifts, and you sort of reevaluate, what you thought was true and possible.
And the third thing to think about here is that not all abortives are equal in terms of their rebound potential. So if you have listened to it or seen it, I did the episode about the future migraine risk score, and there's a PDF I put out about it, basically ranking sort of the various abortives in terms of their rebound potential or the risk of leading to a future migraine. And triptans are about as high as you can get in terms of their rebound potential. Again, likely because they are migraine specific, which is also why they tend to work the best. But there are other things that have a lower potential that, if you're comparing one versus the other, would be preferable. So things like a long-acting anti-inflammatory like naproxen would be preferable to a triptan from the perspective of rebound. So these sorts of things, can function as a bridge in some cases. So whereas you're trading one for the other, maybe the ultimate goal of getting to where you're not needing any abortives, but that's a step that could get you there. So it's another example too, I think, of where kind of all or nothing thinking or a one size fits all approach to things can be harmful. The perfect scenario sure would be never to take anything, but again, compared to taking a triptan, taking something like naproxen would be preferable. And if you're able to get through an attack, taking that when you would have instead used a triptan, which would confer a higher vulnerability to future migraines, and that's a victory. That's a step in the right direction. And so, again, I think that's super important to keep in mind, that we want to aim for progress rather than perfection. And if we aiming to keep making progress doesn't require that we're perfect. It just requires that we continue to try to take steps to get towards where we want to be. It's also, this sort of thing highlights to me why it's so important that people have the knowledge needed to make the best decisions for themselves at any moment, and why I'm very reluctant to give hard and fast absolute rules about anything, because so many things depend on context, even though people like hard and fast absolute rules. But my goal is to teach people the most important principles so that they and understand how they're applied, so that they can apply them to their own specific circumstances, because you are always going to be the expert on you.
All right, thanks so much for listening to this episode of The Miracle Moment. If you haven't already, be sure to subscribe to the podcast in your podcast player of choice. And if you know any fellow migraine sufferers, please feel free to share it with them as well. And now it's time to go out and slay the beast.